Afternoon and welcome to the Board of Health meeting of October 3rd, 2022. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's July 16, 2022 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of the March 12, 2020 and July 15, 2022 orders suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20 until March 31, 2023, this meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 1-508-945-4410, conference ID number 978-35222#, or join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. Now I'll turn the meeting over to our chairman, Noble Hanson.
Thank you. It shall be the policy of this board to conduct its meetings under the open meeting law so as to encourage public participation whenever time permits and as part of agenda item discussions. Tonight we have 5 items on the agenda, and first we'll determine that we have a quorum. So as I call your name, please say you're here. Ron Broman? Here. John Beckley?
Here.
Carol Boyce?
Here.
And myself, I'm here, and we have one alternate, Dr. Edwards. So first on the agenda is a variance for 34 Scattery Road. Attorney Michael Ford is presenting, and he's here tonight. So, Mr. Ford,
yes,
go ahead.
Thank you, Mr. Chairman, members of the Board of Health. Attorney Mike Ford representing Meg McCarthy. I sent a letter at your agent's suggestion addressed to the board regarding this variance. It's a variance from the inspection and upgrade requirements of your regulations. Mrs. McCarthy just purchased today. It was kind of a very quick transaction, 34 Scattery Road. And she does not intend to live there at this point. She has another place that she lives in Chatham. She'll be removing the water meter, and the electricity will be turned off at the main panel, and we'll send a copy of the water disconnection to your board. This is a cesspool, so it's a failing system. And a Title V system has been designed, but Ms. McCarthy intends to redevelop the property, but we're probably at least a year away from those plans coming forward. And so for those reasons, we would ask that the board consider waiving the requirement to inspect and upgrade this system at this time. Happy to take questions.
Okay, just first one question. You submitted an early septic system design, but I'm assuming that we're not acting on that at all tonight. That the owner will come back at a later date when they're ready to build.
Exactly. We just wanted to tell you that design had been accomplished, but it's really not material, I guess, to the request before the board, Mr. Chairman.
Okay, questions or comments from the board for Attorney Ford? I'll just note that Judy has recommended that the variance be granted, and that with the conditions that the new septic system is installed within 1 year from the date of transfer, and the property to remain vacant until the new system is installed. So property remain vacant. The attorney has said that the water and electricity will be shut down as well, and the house will be locked. But
Right.
I guess, Judy, if you say property to remain vacant, that includes those assumptions, or?
Yes. They said in their letter that the property was not going to be occupied and that the water meter was going to be removed and the electricity off, so it would not be.
Judy,
Occupied.
question. In your recommendation to us, you reference an upgrade to the septic system within 90 days of transfer. And then later, you say 1 year from the date of transfer. So
So no.
can the applicant replace and upgrade the cesspool like 9 months from now, so long as it's within the year before they reoccupy? Or do we want them to install the new the new septic tank within 90 days?
No. Our regulations say that they have 90 days from the transfer of property to upgrade the septic system. So they're asking for a variance from that so that they don't need to do that. And
Right.
Oh, I see. I didn't-
grant the variance to allow the transfer of property without the upgrade of the septic system within
Okay.
90 days. So,
But it sounds like we're being asked to indefinitely defer this because she's not planning to do anything within a year. So
Right.
she may want to upgrade the septic system 3 years from now if she's not planning to use the house. So can we just say that the house cannot be occupied until the septic system is
Well, that's-
upgraded? Because 1 year doesn't
yeah, I
meet
mean,
her
I was giving
requirements.
it a year just so that it would come back to us,
Yeah.
and if we didn't hear.
I don't mind that. I could come back, and if she's not prepared at that point, Doctor, we could request some additional time, but we could give the board a status report where it's at, so.
Okay.
Just
we don't
kind
mind
of
doing
more of a
that.
way for us to keep track of it.
Yeah,
If we just say it can't be occupied, then we don't, necessarily have a way to keep track of it.
that's fine. We'd be happy to come back and report.
So in a sense, the house is condemned until such time. In a sense, the house is condemned until such time as the septic system is replaced.
I mean, not officially condemned, but it's,
Not occupiable.
right, correct.
Okay, so the house will not be occupied, and they're given 1 year to come back before they build the new septic system, and they'll come back with the septic system plans to our board, so that's pretty straightforward. Can we get a motion to grant the variance?
I'll make a motion to grant it, because I like the idea of his already offered to take the meter out and everything, because usually we ask for that, and he presented.
I'll second.
In a second. Okay, input from the public out there, 34 Scattery Road.
There is no well on this property.
Not that I'm aware of, Doctor.
Not that I know. of.
Okay, I don't hear anything from the public, so we can take a voice vote. All those in favor say aye. Aye. All those against say no. All right, hearing none, I think that variance passes, so that's all set.
Thank you very much for your consideration.
Okay. And the second item on the agenda is update discussion of the proposed short-term rental bylaw. Judy has sent out the final draft of the draft that we're submitting to the Select Board with a few minor changes from Dr. Duncanson and incorporating the suggestions that were on our preliminary draft we looked at last time. And then she's also sent out a copy of a sort of a brief introductory letter that would go to the Select Board to describe what our thoughts are and what we're asking for, which we all discussed before. But questions about that?
In paragraph C, there's a word missing. The application by the blank shall not be deemed. So there's a word missing.
This is which,
In the
which,
third line of section C.
of the letter
on
or
page
the
2,
rental
on
bylaw?
on the bylaw. There's
Page 2 of the bylaw.
Page 2.
acceptance of short-term rental registration application by the blank shall not be deemed.
Okay.
So I guess it's the town
I think
or the Board of Health?
Should have said Town of Chatham.
Town of Chatham, okay.
By the blank shall.
Yeah, and this is a draft, so it,
Right.
you know,
Right.
the select
Right.
board hopefully will look at this, review it, and then we'll refer it on, so things like that will catch up, but I'll definitely make that change.
Then under occupancy requirements on page 3, plus 2 occupants under the age of 5, I think we need to add per occupants per dwelling, just to make it clear that this isn't 2 occupants per room under the age of 5,
Okay?
That's it.
Dwelling.
That's important.
all right?
Yes.
And then what we don't have in this document is a definition of a bedroom or the number of bedrooms allowed in a house. I mean, I think everywhere in here it says they're allowed to have 2 occupants per bedroom, but what are we using as the number of bedrooms? I mean, we need kind of the same language here that we had in the other documents, that that the number of bedrooms are limited to the number of bedrooms allowed by Title V septic system, or the number of rooms divided by 2.
So you think there ought to be a cross-reference in this wording
Right.
that goes back
You know,
to the
If you just
exit?
took this at face value, you could say, well, okay, we advertise 6 bedrooms in our house, so we can have 12 people.
Wouldn't
You know,
it be
we
the number
advertise
of
8 bedrooms.
bedrooms recorded with the town?
Sure, I
To
could add,
cross-reference it back.
Assessors.
I could add a definition of a bedroom that refers it to the number of bedrooms as approved by water and sewer or.
Or our last
septic.
action, I mean.
Right, just make it
Or
clear
Title
that they
V.
don't just say, our VRBO listing says we have 9 bedrooms, so we can have 18 people plus 2 children
Right.
in the house.
But Judy, doesn't it go back to the assessed number of bedrooms on the official town document? Isn't that the?
Not, you mean the assessors or the?
Yes.
The assessors and the health department have different definitions for a bedroom, so sometimes their definitions are not the same, their number is not the same as ours.
So you have a list, or you have a
so-
listing of bedrooms for all the residences within the health department?
Do I have a list?
You know, do you have a separate list of all the dwellings and how many bedrooms each is allowed according to the health department?
No.
Well,
I have
Where does
to
the
refer
ass-
to the plans on file. if
Where
we
did
have
the
them.
assessors get their number?
I believe their number, and I'd have to refer to the town assessor, but I think, they do on-sites, but they don't do them regularly, so sometimes their numbers are different, or they may count something not as a bedroom that we would count as a bedroom.
So
So,
somehow, a homeowner who intends to rent has got to be told, in the context of this new bylaw, how they can determine what their limited number of bedrooms is.
right. So, there would be different ways to do that. I think as part of the inspectional process, we would determine what their approved number is based on our records, assessor's records, and an on-site inspection.
Well, the Board of Health can do this based on what kind of septic system they have.
If they
Well,
have
Title V.
one.
And if they're attached to the sewer, then we have to have some way of figuring out. If
Right.
somebody's attached to the sewer and says, well, and then I can have 18 bedrooms.
Right.
Well,
we have
no,
to
they
have some
can't, so.
definition of
That's
what we allow.
been
See,
determined.
that's it.
Right. So those will be things that we'll be looking at when we go in, do on-sites, and see what
They
the
need
So
to
to
know
Dick's-
up front
So to Dick's point, what language can we put in this that reference them back to the existing data that, like when we look at a plan, we count bedrooms. Some reference back to that number.
Right. So my first thought is to add a definition of a bedroom that says, as approved by the town of Chatham Health Division, or, I'd have to think
Yeah, the
about
privacy.
the proper
and
way to
the
refer
archway
it.
and all that stuff we've
Right,
gone over.
right. So,
I know that 80% of our town is on septic, roughly.
Yep.
So for the other 20%, how is a homeowner to know how many bedrooms they can legally advertise in a rental?
Isn't their septic system approved for a certain number of bedrooms?
I'll say
If they're
no
on
septic
sewer-
system.
if they're on
They're on the
sewer-
public sewer. They're
the
Sewer,
connected.
you get one, I think you get
The
that
sewer
number plus
department
one.
has records. I don't know how accurate they are, but they do have records of what their sewer is allowed, so.
So if
We could go
I'm
by
on,
that, and we could go by an on-site visit, so it would be a combination.
so if my house is on a septic today, and I've got 3 bedrooms, and then next week I connect to the town sewer, does my number of bedrooms go up by 1?
If you request it, and it's approved.
So then I'm allowed to advertise for rental at 4 bedrooms?
If they actually have 4 bedrooms, right.
No, 3. They had 3, and then they got,
But they would have to add the 4th, or
they'd have to,
convert something to a bedroom.
So if you have a Title V system today for 3 bedrooms, and you put in an alternative system next week, that can be 4 bedrooms,
If approved.
and then if you connect to sewer, you can get 5 bedrooms?
No.
No.
Well, this is going to be very, so there has to be a way that we can make
That's in our
rulings on
record.
every one of these
That's in our,
properties.
those records are in our files.
Right.
So if you put an IA system in, you're granted an extra bedroom. When we go to inspect, or they apply for a short-term rental permit in the future, we would pull the file out before we go, and we say, okay, they've been approved for 3 + 1 with an IA, or if they go to connect to sewer, same thing. They've already got their extra bedroom, so I always compare what they have with what they're requesting
however,
when I review them.
we realize, sitting here today, that there's no way in God's green earth that our town employees, inspectors, are going to get through 900 or 700 rentals. So we have to have a way for them, the owners, who are responsible, to know what they can legally include in their rental
Right.
advertisement.
Right.
So we have to be pretty precise in saying, here's what you can do as a homeowner to determine what your
Right.
legal
Yep.
advertising bedrooms are.
But isn't it
Is-
what your septic system is approved for, basically?
It would be,
bedrooms,
yes,
number?
yep. Yep.
So, but what Dick's point is, what we need is some sort of a general reference here that references it back to the data that you're talking
Yep.
about, so that it can be tracked and followed back. We don't have to write the whole thing out again necessarily, but just
A reference,
make reference to it.
Yep.
cross-reference.
Yeah, no, that's
So
exactly
in
what we
the,
would do.
in the discussions that come up, that it can be,
Yeah,
I'm
certainly.
confused, which document was it that we put that information into? The
definition.
The number of rooms,
We put it into
divided
the
by
nitrogen
2.
loading regulation, and we put it into our subsurface sewage
well,
regulation.
it's not in this. The minimum requirements for subsurface, there's nothing in here about number of bedrooms.
There's not?
No, I read this thing, I kept looking for that in this document, and there's nothing in here that talks about the number of bedrooms. It lists what a bedroom can be, but I don't see the language about
I'll have to go
more than
back. I
8
thought we
rooms.
put it in
It's
both.
not in this document.
So it's got to be consistent, the two.
I always thought that if you look at the town assessor's report, that it has number of bedrooms, and then that was based off the septic system determination. And that was the number of bedrooms that you were allowed.
Yes.
Well, I know from my own, in my house, the building inspector came when we did some construction, and he walked through the house and he said, oh, this is 5 bedrooms. He didn't really address the septic at all. He addressed what the way the house was configured. And,
The building inspector or the
In this document here,
assessors?
it doesn't list, this thing that we have here, it doesn't limit the number of bedrooms. It just says a bedroom is a room that has access and.
I don't know which one he's got.
But you could, but this is the one that we're looking at today, the minimum requirement, a corrected copy of minimum requirements for subsurface disposal of sanitary
that's
sewage. And this.
That's the short-term rental.
That was just, I added a
Are you looking for
footnote.
this?
Yeah, that one.
And I don't see on my copy anything about the number of rooms.
Now, on your assessor's
Under
card,
definitions,
how many
1.1.
bedrooms are listed for your house?
Yeah, bedroom.
How many bedrooms are listed on the assessor's card for his house?
5.
4 or 5?
5.
5. So they have
You're on.
the 5 bedrooms. They know you have 5 bedrooms.
The assessors came to
Oh,
your
no,
house.
I know that. I know
So,
that. But
it's right here under definitions in the subsurface disposal sanitary sewage regs, 1.1,
yeah,
bedroom,
yeah.
that whole page.
There's nothing here that says if a house has more than 8 rooms, you take the number of rooms and divide by 2.
That was a policy that we didn't add that into the definition. We did that by policy because it's already in Title V.
Right.
We had that discussion at one of our meetings. So that's already in Title V, so we felt that we didn't need to add it into the regulation because it's already in Title V, so we already have the right to do that
So,
by Title V. This is our local regulation, which is stricter than Title V. But we can use, when appropriate, that total number of rooms divided by 2.
but in here, does this limit the number of bedrooms a house can have? If you have 10 rooms that meet all these definitions, then you can have 10 bedrooms. There's nothing.
That's just a definition of a bedroom.
Right, so
It's not how
where-
we count them. I mean, if we look at, if a house has 12 rooms, and there are rooms that don't meet that, we would use the higher number, which either the total number divided by 2 or that number.
Right, but somebody that wants to rent their house, looking at this document, doesn't see anything that limits the number of bedrooms that they can have. So
Yeah,
what we're gonna say is, for every rental, we will make the determination.
it's going to be based on the number of approved bedrooms that we have. So if, if we have a septic system for 4 bedrooms, no matter the number of rooms they have, we've already approved it for 4 bedrooms, then that's what they're going to be able to have, is 4 bedrooms to rent out for their occupancy.
So then we'll check each one of those applications
We will,
to make sure that the
That's-
number of bedrooms is appropriate.
Yes,
And if they're on a sewer system, we'll look back at,
and any ones that are questionable, to your question, John, would be, we could prioritize, I mean, this is all down the road, but we could prioritize ones for inspections that we have questions on, as we move through the system of registering people.
We're going to have those applicants sign a form
Yes, that's
that they send to
the
us.
thought, yes.
Why can't we put some question in there, the form that they have to declare and fill in,
Right,
referencing the number of bedrooms, asking them to indicate the number of bedrooms that they have that's tied to their.
we definitely could do that.
But
In
on
other
that
words,
form,
have them think through
And
that
there's also
process.
deed restrictions on some houses. We could ask them whether the house is deed restricted to a certain number of bedrooms. We have quite a few of those now after all.
Make the applicants consider accurately to look into their deed, so that when they answer the question in the application they're filling in, they're basing it on some objective source.
Right.
so
Yeah,
do we
I
need
think-
a statement in here saying the total number of bedrooms rented cannot exceed the number approved number of bedrooms approved by the Board of Health based on,
That's what I'm going to add.
yes,
for
or
the
something like that.
definition.
But I think when they apply, in the process, the town gives them an occupancy limit and a bedroom, how many bedrooms the house has. And those are on their registration form that they have to post, so that when someone inspects or whatever, it's there written.
But we need
And-
to
and you
make
can check
sure
it with
that they are
advertising.
using that reference as the number that they're putting in their form.
Who's that, but I don't think you can leave it up to the applicant to decide how many bedrooms they think they have. The town has to basically tell them based on some data that Judy has.
But when they fill in their application for their rental permit, right? There's gonna be a question, how many bedrooms are you planning to, to advertise your house for? But then that has to then be referenced back to.
Right.
To an
And when
objective.
they do the inspection, they will.
Right.
But I'm saying it could be 2 or 3 years before some of these homes get an inspection. So we want them getting off on the right foot with an accurate intent.
So these are all things that are, we're gonna have to work through as part of the process.
Mm-hmm.
We don't need
We're
an
there yet.
inspection.
No, not.
We don't need an inspection. If we just say that your application will either be approved or disapproved, and one of the reasons that it would be disapproved is if you're asking for more bedrooms than you're allowed under the
We need
assessment.
we need some kind of guidance in that form, saying number of bedrooms you're planning to, parentheses, please note that this must be based upon your current assessment or, whatever. But my point is, let's help them be accurate with that initial declaration of bedrooms they wish to rent right from the beginning.
Yeah. So, these are all things that we're, not to kick the can down the road, but we haven't got there yet. So
Yes,
we'll work
okay.
on all these details, and there'll be many more, I'm sure, that we'll come up with along the
Okay.
way.
But my understanding is that they apply, and then basically the town, through their documentation, tells them how many bedrooms they're certified
Are
for.
we going to go through 700 of them before the first
Well,
one is
when
issued?
they finally get that certificate, yeah.
It will have been reviewed before they get back.
But every Title
I
V
hope so,
system
at
is
least
is for
reviewed.
so many bedrooms.
And we may not get out on site, but I would
Okay,
hope we would
but
at
we'll
least
have,
review
we'll
it.
at least do a paperwork review.
Right.
Before we assign, okay, well, that makes me feel better then.
Yeah.
Okay.
I think the estimate was, if they hire a person, it'll probably, it won't, this thing won't come into effect for a whole year. So they have a whole year to sort of catch up with it. But I think Dick's point was making a reference back to the determination of the number of bedrooms, to whatever rules
I think that's a good
we have,
idea, and I will-
so that
I will
it's
put
not,
some wording
it's
in.
not, it's not based on what they think they have, it's based on what the town thinks they have.
Yes,
Yes,
exactly.
Or are allowed.
okay.
Right.
One other question. Have you ever looked at what the town has, under their septic systems, and then what they have on their deed? Or what they have on where else they have it in the town?
Is it,
The assessors, you mean?
Assessors, yeah?
Yeah, I do it all the time.
There's not a big difference between them.
I check to see what they have and what we have, and I use that all in kind of the process of figuring it all out. And quite often, I will send the assessors something saying, we consider this, if they only have it as a 3-bedroom or a 2-bedroom, I say, we consider this a 3-bedroom, so that they can have that in their records and make theirs correct to ours.
So it would go by your records, basically.
Usually, I send that to them and leave it up to them to decide how to do that, but yes,
You just let them decide.
right.
what do you mean, you let them?
Who decides?
The assessor, the town
The assessor
assessor.
says 4 bedrooms, and we say 5 bedrooms. Who's going to make the decision on what?
Well, as far as sewerage and septic goes, I make that decision. So if I call it a 5-bedroom, it's a 5-bedroom. Whether they
That'll be the
assess it for
decision.
5
And
bedrooms
that's
or
the
not is
decision.
their,
All right, that's all I want to know, who would make
Yeah.
the decision?
Okay, so I think, so we have to come up with a language to get us to the next stage, but to make reference to how these bedrooms are determined by the town.
Right.
And then, okay, so I'll ask Dick, that's page 3. Did you have some other ones on the remaining?
Well, the next paragraph, parking. What is this? There shall be no off-premises parking without the permission of the off-premises owner. What does that mean? That you can park 6 cars in your next-door neighbor's driveway if your next-door neighbor says that's okay?
sure.
Yeah.
Really?
That was in the original document that we got from Orleans, so
Really?
we
But
left it in.
What we did add was that there shall be no more than 1 car per bedroom allowed parking, which is
Right.
pretty strict. But I think that would take, well, that's the number, yeah,
So
so if they got permission from a parking garage somewhere, they could add 10 more cars? Is that-
well, I don't know, I just was,
Do we need that line in there at all?
What's to
I
stop
think
them?
these are things that we're gonna work out as.
Basically, there shall be
we
no, it's basically, the intent is there's no off-premises parking,
We can take that out.
right, correct? There should
that's
be
what I
no
thought, and then
off-premises
this was a
parking.
surprise to me when I saw this,
I-
this business
We
about
can just delete that, I
off-premises.
guess, you can,
Yeah,
I mean, these are, I've already sent this to the select board, but these are things when we get to the
Fine-tuning.
next stage of review. Again, this is a draft, so we can.
and you'll
have
be
those
part of that,
discussions.
hopefully, if
Yes.
that happens.
because they could show up with 8 cars, and they could park 6 of them at the ShopRite parking lot, and then bring only 2 back over to their house they're renting. Right?
I don't know, I guess so.
You want to do that?
Didn't
It
you want
happens
to?
all the time, I'm sure. I mean, you
Didn't
go
you
to
wanna say,
Provincetown
though,
and
that
you only have 1 parking space in the driveway, you go and park in the town lot with the other cars, you know?
Right.
Right. But didn't you want to have something in here that the cars needed to be parked on the premises? Not just,
On premises, yeah, on premise.
Well, right now, it says there shall be no off-premises parking. That's the way the document says. Now, this is all
But
going to
she
be
said she
reviewed.
was gonna take
And the
that
lawyer will
out.
have to look at it and come up with specific language, and
Yeah.
there'll be questions, so.
I
I mean,
again,
part of our
I think
intent
the-
is to get a document that's full enough that it's a basis for a discussion and a finalization of things.
Right. These things, I think, we're gonna have to discuss with community development
Mm-hmm.
and the police department and zoning, planning, so
I think
everybody
it's-
kind of,
I think it's a good idea to have no off-premises.
Yeah, that's what I would say.
Who wants to see a car out there with 6,
At least for now, if somebody brings up these other issues, they can deal with it, in the next
Yeah.
discussion. So we'll just say delete without the permission of,
oh,
we'll just
delete
say,
that.
there shall be no off-premises parking,
Period.
period. Good.
Okay.
Yeah, that's,
Okay, Dick,
that was my understanding.
any more?
All right.
No,
Are you done, Dick?
No, and, okay, so that's,
Okay, there
these
was a
are all
lot of
good things.
discussion last time, so I, was trying to
And I'm sure,
capture what you wanted.
we're having a discussion among ourselves, but once you get a wider discussion, there are gonna be issues that come up that we haven't thought of.
We haven't even
So We don't
thought
know
of.
what we don't know,
Right.
so this would be, like I say, a process.
Okay.
Okay,
It's a good
anybody else?
start.
We have someone from the audience.
Gloria?
Gloria?
Is it Elaine? It says guest.
Yes, it's me, thank you. I'm just a little confused here. I understand that, the Board of Health is taking the lead on this because of, water usage and such, but, as I think you alluded to, it's a much bigger thing. It's not just that, it's the impact on the town parking, the environment, and everything. And I guess I'm confused about the fact that the assessor's office, for some reason, might be different. That's what people are being taxed on, rather than the idea that they qualify for X number of bedrooms based on, the number of rooms divided by, I don't even understand that formula, +2 or 1. If they don't actually have the bedrooms, I don't know how we should be approving that they can, even though they have the potential for the bedrooms. And granted, I know it's based on water as far as you're concerned, or sewer. But if they only have 3 bedrooms according to the assessor, it seems like that's all they should be able to have is, 2 per bedroom, 6 plus the 2 under 5. If our own town records don't agree with each other, you're gonna have a real problem enforcing this. And, the assessors have been, as I said, they've been taxing on us on the number of bedrooms. And it seems to me that's the number we should go by. And if they disagree, then they should go to the assessor and get it changed. I mean, we have to have some definition, some legal record in the town already that says how many bedrooms there are, even if they have the potential for more, because it's a big house. But if they don't have the number of bathrooms, let's say, and people are sleeping on the floor, it defeats the whole purpose of the short-term rental. I know that sounds confusing, but I think, unless we can't just say, oh, well, the assessor's office has different criteria than we do. I think that they're the ones that tax us, so I think that's what you should be using.
So
Whether or
when-
not they have the potential to
When
have
the
more
assessor's
bedrooms.
number is different than ours and it's brought to our attention, we do let them know, and they make changes as appropriate, as far as I know.
Well, yeah, but again, they're the ones that are driving it in term, they come in all the time. They're on people's properties all the time. They said they can come in if they want. We need to tell them, otherwise they're gonna tax us, accordingly. And, that's all driven by the state. So I guess I don't understand why somebody can't say that these records are accurate unless the homeowner proves otherwise, and say, we're using the town assessor's number for the number of bedrooms that you currently have.
That would be the easiest way to do it.
You know what I'm saying? It's-
Yeah, no,
think
yeah,
this is
I understand.
way too confusing.
Frankly, I always assumed that the number of bedrooms was what was the number of bedrooms on the assessor's card there that you can pull up online. We're always determining number of bedrooms allowed by the Title V septic system. That's, and that information has to be somewhere, but I think we agree
But,
that
I mean,
we have to
legally-
come up to a firm definition of how this number of bedrooms for each house is going to be determined, but that's something we need to work out. So in a way, we are agreeing.
Yeah, it's because, as an example, when you put your house on the market for sale, real estate brokers are bound by what the assessor's office says.
Yeah.
You can't say, I have 7 bedrooms when you only have 5. Illegally, you cannot advertise that there's 7 versus 5. You have to advertise for what is in the house, or vice versa. So I guess I think that's probably the most standard thing we have. And then if we find out there's something, then the assessors can change it. But other than that, it should be up to the property owner to say, oh no, we have more bedrooms. Because just because they have the potential for the bedrooms doesn't mean, I don't think, that they should be able to, if they don't really have bedrooms, that they should be able to have people, sleeping in dens and, sharing bathrooms and stuff like that. It defeats the whole purpose of trying to control the number of people staying in a house.
Right.
And that would apply to parking as well, and I absolutely agree with you. There should be no mention of parking on the street or neighbors or anything like that. Once again, I had 12 cars next door to me, and they would shuffle them around, and there is no way that they had that many people in the house. If they did, we had an even bigger problem. So you got to limit parking, because that is really bad for butters. Thank you.
But I agree that from our standpoint, the number of bedrooms is determined by the septic system. And we've seen all these houses with many, many amorphous rooms, which has nothing to do with how many bedrooms they're allowed. That comes from the size of the septic system. But what we'll do is make reference in this document, and then we'll have to determine exactly how the town is going to determine how many bedrooms that home is allowed. And that will have to be worked out in the ongoing discussions.
Yeah, I mean, I think the presumption is that the number of bedrooms that the assessors list is in line with the number that is allowed.
That's what I've
by
always
the
assumed.
septic system, and should not exceed the number allowed by the septic system. And if we were to discover that that were the case, then we would have to contact the assessors and have them make a change.
Right.
Because,
They're not always the same, so
But
usually they have
But it shouldn't be
less.
more
No,
than
they
the
usually
septic
don't have
system
more.
allows.
It's most of the time they have less. So
Right, well,
they'll
that
say
wouldn't be a
2.
problem.
They say 2 and we say 3, so I let them
Maybe part of
know.
this process is going to be to update the assessors form, so it is all in agreement, and there's
Right.
one number that everybody has access to.
Yes.
How many properties do we
Your neighbor
have?
can look up the number.
How many properties do we have in town? Several thousand?
Yeah, I think there's, I don't know, Bob would know that number. I want to say,
But I mean, there could be a reconciliation along the way here with somebody goes through and makes sure that that their database is in essential agreement with ours. And then I agree, then use that as a de facto.
what often happens is the realtors, when they go to sell the property, we'll say, the assessors have it as 2, you have it as 3, and then we,
Work it out.
we work it out, and then I let the assessors know that they have a 3-bedroom septic system, they have 3 legal bedrooms according to our definition, and that's what we consider it, and then they, they do what they do, they change it.
Yeah, I mean, for tax purposes, it would be
Right.
beneficial to have a lower number of bedrooms if you're not using all the rooms in your house as bedrooms, even if you have a septic system that could handle more bedrooms. And so I can see why a person might not want the assessment to say your house has 4 bedrooms if you're only using 3.
Right.
And that 4th room is not being counted
You
as a
can't
bedroom,
do-
it's
you
a
can't do
billiard
that.
room or something.
Right.
But that's fine. The problem would be if it's the other way around, and you have,
Can I answer, Jack? Did someone ask how many properties there are in the town?
Yes,
Yeah, there are approximately 6,200 residential properties in the town and a total of about over 8,000, including commercial properties. And that's why, going back to your conversation a couple weeks ago, where there was a question about, I think Bob Duncans was talking about the number of people who actually live in a house. There are also 6,200 residents. So I would, you can extrapolate from that most of the homes in Chatham don't have more than 1 or 2 people living in them full time, because the numbers are equal. The number of people we have, homeowners, properties, and the number of people in the town. So,
but
I
half the
guess-
houses are unoccupied for half of the year.
well, exactly, but then they're occupied, but we don't know that number because they're occupied as summer rentals. So I'm just saying that's the number you should be dealing with. There's 8,000 properties on the assessor's database. Those are the numbers Dr. Baum has been using for sewering of Chatham for many, many years. And that number doesn't change very much because there's a limited amount of land. So those are the numbers we're working off of.
Okay, thank you. So can we say that Judy will put in, or we'll get into this, a reference to the official number of bedrooms in a house, and we'll check on the database for that. That'll be part of the ongoing discussions. And then when you get your registration, it'll be number of bedrooms and occupancy will be on each one. So it's all uniform, work in
Right.
that direction. Will that suffice, you think, Judy, for right now? Sure. Yeah, okay. And then, all right, so then the other thing was Judy sent out a draft of just a cover letter, which basically is the things that we had discussed as an introduction for the select board. And that is going to them, or has gone to them, and it just points out what our basic thinking is. I think it's kind of general. Does anybody have a comment on that, or a question, or had a chance to read it? I don't know.
I don't.
But it stresses we need an occupancy number and a bedroom number. You have to register. It asks for a working group with widespread community input to work on a draft. It states that we feel strongly that the bylaw is important. Ask the select board to create a task force, Board of Health representatives, select board representatives, other committee representatives, and other interested parties in a board that will finalize the bylaw that would go back to the select board then.
Does it
And
discuss?
the goal is, and I think I have asked Dr. Duncanson several times, he thinks it's reasonable, the goal is to have a warrant article on the
Okay, we mentioned that.
spring
yeah,
meeting.
it's in the letter.
Okay.
This is
And with funding.
This is something that was sent as an
Yeah,
email.
Judy sent it this afternoon, I think.
It was,
This afternoon.
I copied you on the email
So,
to
it's a little
the
late.
town manager's office today.
But it emphasizes the timeline.
Okay, good. So,
And then, with funding. So it's a warrant article for the May town meeting, for the bylaw, and the funding,
and the startup funding, right? Year one.
which is, it's, assumed it'd probably be 2 extra people the fee of $150 per rental property would probably cover those costs by and large, but that has to all be,
So, okay, so there would be an opportunity to have newly hired staff get involved in addressing
Yeah.
any inconsistencies between the, the deed specification. And so we could actually do that in our
as Bob
first
pointed out,
year.
the funding will become available July of next year. That's the fiscal year starts. And so that's when the people will be hired, so it'll be the following summer that these thing actually gets implemented. So there's gonna be a whole year
To do the
of a
prep,
rolling-
do the startup work and organize and
Yeah.
make sure it's crisp and ready and thought through and,
Yep,
okay.
Now.
They would start the registration
they would start, yes.
in
As soon as
23.
they're hired and we get,
Right.
all the paperwork, and the
Like
computer
the
system,
fall of-
programming and all that, yeah.
Fall of 23, you
Hopefully.
could start the registration for the summer of 24.
Yes,
Gotcha.
yes.
And so it asks for a working group, suggested as before in the 2017 working group, there were 2 members of the select board, there were 2 members of the health board, and the health agent, Dr. Duncanson, and Katie Donovan, I believe, was on it. So I'm guessing if they make a working group, it'll be approximately the same. So it'll be 2 members of our board will be there with this. And I also assume that we'll keep this as an agenda item, so we'll have a discussion ongoing.
Yep.
And we can have further input from the board. We can send them letters or recommendations or whatever into that committee, I would guess.
Yep.
On an ongoing basis. If we change our mind and say about this or that, we can put that recommendation in.
Right in.
And we'll have a couple of members, so we'll have input.
Yep.
So, and then we had asked for it to be placed as an agenda item on the select board meeting, and I understand this may go on the select board meeting for
We're hoping
tomorrow, but a week
October
from tomorrow. That's a possibility.
October 11th,
October 11th.
okay.
And then that's what we're working towards.
Okay,
And then Dr. Duncanson's away today, but he'll be back for that meeting.
right.
Okay, is there any other, okay, that's the short-term bylaw where we are. Any other public input or,
Nope,
okay, and then we'll move on to the next item. And this is 32 Mill Hill Road, John McGrath, update discussion. Dr. Duncanson's not here. I will just say that Michael Whiteside on September 29th, that's last Thursday, had an inspection on the property. I was there, and Lieutenant Andy Goddard from the police department was there. Mr. McGrath was not there. Mr. Whiteside thought he would be there, but he wasn't there, so whether there was a communication problem, we don't know. At any rate, Mr. Whiteside examined the property and said there was no material has been transported off-site. That's his conclusion. With the reinspection, no material had been transported off-site, no progress.
Okay.
So Mr. Whiteside is going to communicate to Mr. McGrath. He's going to set up another inspection for 10/20/22, 3 weeks, and re-inspect. And Mr. Whiteside has said he's the Mass Department of Environmental Pollution person. If there is no noticeable progress, he will speak with his solid waste section chief about going to the next step.
Right.
Their next step. So I think that he's working things along, and we just have to wait for how that progresses. Now, the next step is probably fines. But he also said that they do, if the fines aren't responded to, it's not always just a lien on the property, but they have a process where they have actually hired private collection agencies to work on collecting the fines right at this time. So it's a little stronger than just a lien on the property that goes at some later date. And the only other thing of note was that it doesn't fall under the Mass DEP, but there's new cut wood on the town property just behind the guardrail. I think when somebody went through and trimmed the trees for the gas line going through there, Mr. McGrath apparently talked him into leaving all the wood there for him as firewood. And there's other scrap wood, some 2x4 pine, other things that are collecting on the side. I drove by today, and there's also other stuff that's piling up next to the trailer that's back there. So that's just an ongoing thing. But at any rate, we have 3 weeks, another inspection, and there's an opportunity for 2 of us to be at that inspection, and Andy Goddard will be there, and Mass DEP, and we'll just have to wait.
I hope to be there, too.
And Andy Goddard, I asked him, he's assigned to this specifically because of the complaints that the police have received about the property variously. And so he has been assigned to look after 32 Mill Hill Lane. That's why he is there.
Okay.
He's officially like a one-man committee for the police department dealing with
Keep
this
track
property.
of what's going on.
Okay, any board comments on Mill Hill? And any public comments on Mill Hill? Excuse me? Okay. All right, and then update discussion, Chatham water quality.
I don't have anything.
Yeah, Dr. Duncanson's not here, so
He-
Judy.
He'll be back this week, so
Okay.
at our next meeting, he can give us an update on where we're at on all those issues.
Okay, any comments from the public? All right, and then update discussion, COVID-19, Dr. Duncanson's not here. Anything new, Judy?
Just the monthly, we had a total of 41 cases, just 2 more than last month. Our percent positivity has gone down slightly from last week to 9.5. Our incidence rate actually went up at 1%. Basically, from looking at the state's records, everything seems to be kind of level across the state, from what I'm seeing. So there is no significant changes. I don't have any hospitalization records to report. I wasn't able to get those. So basically, just kind of status quo in the COVID front.
And then the vaccination clinic?
Yep, so we have a flu clinic / COVID booster clinic scheduled for October 19th. It's going to be run by Cape Cod Healthcare. It's going to be from 2 to 4 on October 19th at the DPW building on Kroll Road. And in order to register, you have to call the central scheduling line for Cape Cod Healthcare, which is 508-862-7000, 7000.
And is it a drive-through?
It's a drive-through clinic, and you can get both a flu shot and a COVID booster shot that day if you wish. One or the other or both. And I urge people to call, and if they tell them that it's booked up or that something's not available, they should persist, because we've had some issues with the schedulers there not giving out correct information. I had them tell somebody that the clinic was full, and I said, well, that can't be true, so I checked, and it wasn't true, and they called back, and they
So
got in no problem.
10/19, 2 to 4 p.m., and the way to register is by calling the 508-862-7000 phone number.
Yes.
Okay.
So that's that clinic, that's our adult clinic. We are going to have another clinic on October 26th, which is for town employees, school family members, school-age children, and that's going to be flu only. And I don't have the registration details for that. There's a link, and
Define
that
a-
will be posted on our website.
Define adult.
Excuse me?
How old should a person be to be considered an adult?
18 and over,
18 and over?
yeah,
Okay.
yes.
So the pediatric clinic then is going to be what date?
October 26th from 2 to 5 at the DPW. and there will be an online registration for that. It just went out, it's just going out to the schools today, and I distributed it to town employees, and I will provide you all with the link as well. So,
Both of these clinics are Pfizer vaccine? Or
for the
Flu.
COVID, they're gonna have, hopefully they're gonna have Pfizer, they have Pfizer, there was a backlog of, they didn't have the Moderna. They told me today that they do have it now, so that should be in the registration availability for Moderna. That's just the flu clinic, flu/COVID clinic on the 19th.
And does anybody know any further information about this talk about getting a different booster than you had previously? In other words, if you had Pfizer, get Moderna, or if you had Moderna, get Pfizer?
I mean, on purpose.
Yeah. There has been some talk that it might be beneficial
For cross.
to get a
They've
different.
said that since the beginning, but I've never really heard a definitive answer on that. They do say you can get both, either or, so,
Right.
yeah. But people, I think, like to get the same one they've been getting, I think, from what I'm experiencing. The other thing I wanted to say is that we still have an abundance of COVID antigen test kits, home
Good.
kits, that are available at the health department. They also have them at the Council on Aging that people can go pick up.
Is the COVID vaccine they're offering, is it the new one or?
The bivalent.
The same?
No, it's the new
The-
bivalent booster. That's from what I understand, that's the only one you can get now.
Right now.
Yeah, is the bivalent booster.
Okay.
So,
Just as an aside, it seems that there's really a lot of COVID around. I mean, in my sphere,
your world.
three families that I know have all had COVID in the last 2 weeks.
Okay.
But they tested home, and nobody knows, they don't call and report it. Their kids have had it, the adults have had it, there's
There's
no way to know
that's happening from a
the,
data
from a public
collection.
health standpoint.
Yes.
The
The
State
only
Department-
ones we know about are the people who go in and get a PCR.
right, and the State Department of Public Health is fully aware of that, and they just feel that at this point, we've talked about, we're at an endemic stage where it's around, it's like a flu season, except it's year-round, people are getting it, they're just urging people to get their boosters, get the new one, and then a year from now, I'm sure we're gonna be doing this again, boosting people. It's just,
Yeah, too bad you couldn't get a handle on it, and that information could be used to encourage people to get the booster if we were having surges.
The only information we have is the
PCR.
sewer, the amount that's in the septic, in the Boston sewer system. And I heard that had gone up again, but,
Yeah, I read that. Well, it raises the question, I brought it up before. Who is getting the PCR test nowadays? And the percent positivity that comes from the PCR test, what populations is that sampling and coming up with that number? We don't really know. I'm not sure it means as much, but the wastewater is.
yeah,
and
we can get you a
The
wastewater.
in-hospital number is.
We can
is
get you a
real number.
wastewater report, and, I mean, what I would think for the people who are getting the COVID tests are people that are going for hospital
That's what I think. If I got sick,
surgeries, or they're going to the hospital,
cruise.
or they have to get tested before they go for surgery, those types of things.
but if I call my doctor,
Or-
say I start getting symptoms, and I call my doctor, and they go, okay, John, we want you to get a confirmatory test, and we want to give you an antiviral, medication within the first 5 days, right? Wouldn't they tell me to go get a PCR test?
No.
They
I
wouldn't.
I
don't know.
don't
Okay.
know.
Okay,
The
My
CDC
just
recommendation,
went on my home test.
okay. Say it again.
the,
My PCP went on my home test.
Okay,
and prescribed
May
you
depend
medication.
on the doctor.
Prescribed medication.
okay,
They did not require a PCR to
Okay.
confirm it.
okay.
I think the official guidance from CDC was don't go and get a PCR test, assuming that it's just sort of redundant, act on your home test. I think that was
Okay.
their guidance.
Yeah.
Okay,
I don't know if it's
That's what the
changed.
state's saying as well.
okay.
So it's kind of, yeah. Okay, so that's COVID update, okay?
That's it.
That's it, okay. And then I guess, any new business or something else to bring up?
Someone, I think,
Is someone, a public have some input?
We do. We have Gloria?
Hi, thank you. It's Gloria Freeman. I would just like to know if there is information on which we can rely that it is safe for people to get both the COVID and flu shots at the same time.
My understanding is that the state is saying it's safe.
I've heard it
and
on the news.
appropriate to do that. They're definitely pushing that. Every meeting I've had, they're saying, yes, it's safe to do, and they're doing it. We're doing it all over Cape Cod right now. All the health departments are giving COVID and flu shots at the same time.
the CDC may have,
I mean, I'd have to look and see, but I haven't heard that it's not safe, and it's happening across the board.
Is the Mass DPH coordinating these flu clinics and providing all the?
No, they're not,
Flu-
they're not coordinating it. I mean, it's going through the Barnstable, or our COVID vaccine comes from Cape Cod Healthcare. But
Right, but I don't know where I read it, but I have read that it is okay to take the flu and the COVID shots together.
yes,
That even goes back years ago when we were talking about pediatric vaccines.
right,
They've always said it is no contraindication.
right,
If you need 2 shots and you're at the pediatrician, you give one in each arm.
yep. And that's basically what we're doing.
There's no advantage to doing it other than the convenience.
Yes.
You know, and if you're like me and have nothing else to do, it gives you another day to go out of the house and do something. You go and get another shot. But there's no downside risk
Exactly.
from getting them. Other
Exactly.
than that you may have a little soreness in
Concurrent soreness.
2 hours.
Yes.
Okay,
There's one more
oh,
hands up. Elaine?
Yeah, I was going to ask the same question because I've read that, there can be contraindications of having both of them, particularly if people have had an adverse reaction to either one of them. It gets compounded when you have both. And one can, if you're getting the flu shot too early, they can impact the effectiveness of the flu shot. I just think it'd be worthwhile to put a caveat that, particularly elderly people who have had bad cases of COVID, that they should, check with their doctors. Because I think that, having 2 vaccines, when people have had reactions to both of them, would be prudent, particularly in our population where it is an older population. It's just a recommendation. I don't think I'd get them together, but, that's just me.
Well, the other issue is that if you get 2 shots and the next day you have a fever, you don't know which shot you're having a reaction to.
Yeah.
So, if it isn't necessary or particularly extra convenient to get them both on the same day, the way I did it was to get them on different days because, again, there is that issue that if you have a reaction, you wouldn't know whether you're having, and when next time you go, they said, do you have a reaction to the flu shot? You say, well, I don't know. I got the flu and the COVID at the same time and I had a reaction. I don't know which one I'm having a problem with. So that is an issue.
okay. Anything else under new business? All right, well, maybe then we just have to approve the minutes from September 19th. Does anybody have any corrections or additions or comments on that?
this is, to answer their question, this is DPH, Massachusetts. They're recommending you get both
At the same time.
at the same time,
Right,
right here. Can be given at the same time.
right. So Carol has pointed out that the Mass DPH does say you can get both at the same time. Now, the issues of special circumstances, allergic reactions, those would be special cases for your doctor. So, minutes of September 19th.
I'll make a motion, we accept the minutes of September 19th.
Second, Ron, a second. All in favor, say aye.
Aye.
Opposed, say no. All right, so they are approved. And then, can I get a motion to close the meeting?
I'll move that we adjourn the meeting.
I'll second.
All righty, and then all in favor, say aye.
Aye.
Opposed? All right, so we are adjourned.